Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? Comment 1. There is a reason the instructions for prescription suppositories say unwrap and insert, and not just insert. Comment 2. I'm a pharmacist. One evening shift, I was working a relief shift, not my usual pharmacy. A man comes in, looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Me, okay. I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night at 7 p.m. on the couch. Whoa, TMI. I just need to know approximate time to know if Plan B will work. Me, we have this medication called Plan B, and since the incident happened within 72 hours. Man, oh yes, I got that for her already yesterday, right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks, at least. Man, we're just really anxious, because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin? Minerals? Food? Me, she's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me, no sir. There isn't anything you can take now. He just needs to disconnect the Bluetooth between his balls and the swimmers. Comment 3. I work in home health. At my last job, I had a lady call, saying she was returning my call, specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her. Which, I tell her. She gets mad and starts screaming at me, won't let me get a word in, to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless and idiot, you name it. Whatever, it's slow, and these calls are usually good for a laugh. She takes a breath. I say, ma'am, I'm not sure who called you, especially since we haven't heard of you before now. She interrupts with, no, it was definitely you. You said your name was Shelaton, and you were calling from Advanced Home Health. Ah, we have detected the problem. I tell her, I see what's going on. You accidentally called Amber Care Home Health. Let me get you Advanced's number. Then she says, I have it. They didn't pick up the phone, so I called you guys. I was not expecting that one. Comment 4. 73 here. Former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay. A challenge then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He couldn't or wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe that act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back. Patient provided improper specimen. Comment 5. Paramedic. Elderly woman complains that her mouth is dry, and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what? Fixed it within 5 minutes. Comment 6. Physical therapist. Had a patient with neck pain and spasms. Also complained of anxiety and heart palpitations. Asked about caffeine intake, and patient revealed drinking an average on 15 to 20 cups of coffee daily. Comment 7. Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently, what happened is, a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol, and shot it. The bullet ricocheted and hit his son in the leg. Comment 8. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on, and asking different questions on the medications. When she pointed to an Apoquel, stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag. Also, why she is mixing all her meds in a bag in the first place. Only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container, to protect the medicine and herself, and to know the directions of how to take it. I've seen her a few times since then, and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Comment 9. Rural ER doc here. 35-year-old female walks in with right-sided jaw and neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later. Oh yeah, and I accidentally swallowed a bee, and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Comment 10. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery. And she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like, no clue. My mom usually said something like, how you got it in is how it's coming out, honey. This was the late 90s, early 2000s. Comment 11. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog, that he wouldn't be able to breed it. Comment 12. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex, and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened. And when I returned to check on her a short time later, she asked me if she could get pregnant, even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in, sperm travel. Comment 13. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers, every care and meds that he needs to take are prescribed and explained. Medical appointments with a cardiologist and arytmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answers any calls from the hospital. This went on for around 3 years, until he shows up without former warning and asks to talk with the doctor that did the procedure to put in his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup with a big infected open wound above it, with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis, or any other health problem that may appear for that matter. Comment 14. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of Tennessee. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital. Comment 15. Saw a chart once where a person came in for a burn to their eye. They told the doctor, they read online, that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Comment 16. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there, however, has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up and the medication tasted bad and was hard to swallow. I do sometimes wonder how people put one foot in front of the other. Comment 17. Had a patient come in for facial burns because he smoked while wearing his oxygen. Twice. In the same week. Comment 18. I'm in the ER. So many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers, building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause, and her sister staring at the ceiling, I told her, no, because they speak Portuguese in Brazil. Patient seemed relieved, and the sister hustled her out of the ER before I could discharge her. Comment 19. Former practicing surgeon. Male came in with a small bowling pin up his backside for the 3rd time. Comment 20. I worked emergency department for 10 years. Every day people come in, and it shocks you how they manage to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We of course had to ask if he has had sex with her, and he said no, but they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama you're my sister shit, we had to educate him that is not how it worked at all. Comment 21. Diabetic patient with foot ulcers that kept being infected with a lot of different gut microbes. Turned out, he used to put his foot in the toilet and scrub the open ulcers with the toilet brush. Comment 22. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have 10 cents. Which is not a lot, but it's weird that it happened twice.